like my sister was just writhing in pain for so long. And it just haunts me. And, you know, the last moments with both my mom and my sister are just ingrained in my head.
Eric Andrist is overcome with emotion as he remembers the death of his sister, Callie. Andrist cared for his mentally disabled sister day and night.
And even though she had the mentality of a 4-year-old, she could sing and dance to those songs, and she knew more about musicals, I think, than most normal people.
As Andrist explains, he took Callie to the emergency room for a stomach ache. Days later, she was dead.
This is her record from just the 3 days that she was in the hospital. I mean, this is how much stuff that I've gone through to find out what happened to my sister.
Deadly medical errors can happen at even the most highly rated hospitals. New research shows that up to 440,000 people die every year in America from preventable medical mistakes. That would make it the third leading cause of death in the U.S., following heart disease and cancer.
The incidence of people dying of errors and accidents in hospitals is abysmal in this country. It's really a crisis level of problem.
In 1999, the Institute of Medicine reported that up to 98,000 people a year die because of mistakes in hospitals. In 2013, a study in the Journal of Patient Safety says that number has grown to be between 210,000 and 440,000 patients. That's more than the population of Miami, Florida. Not all medical errors kill, but they can still cause a lifetime of pain.
When I left the operating room, I had a fever, I was nauseous, I was having chills, and I was told that that was probably due to the anesthesia.
Actress and model Alicia went to the hospital for a minor surgery. She expected to be out in a few days. Instead, she contracted necrotizing fasciitis, also known as man-eating flesh disease.
So you can see this is all eaten out here and cut away, and right here it's spreading down my thigh.
Years later, Cole is still in physical therapy. Her claim of hospital injury is not isolated. Shelly Skalicki was diagnosed with spina bifida as a child. In 2008, she went into the hospital for elective surgery to relieve some of her symptoms. Skalicki and her husband, Danny Cole, used to enjoy an active outdoor lifestyle. However, after a trip to the hospital, Skalicki came out a quadriplegic and now requires round-the-clock care. Home videos show Long helping his wife to do the simplest tasks.
We have never been allowed to talk to any of our doctors. We're not allowed to talk to the patient safety department. We're not allowed to talk to the ethics department. We're not allowed to talk to anybody except Duke lawyers.
Because some states have caps on malpractice claims, many lawyers refuse to take on cases of medical error. Despite Long's frustration with the healthcare system, the love for his wife has strengthened during this time of struggle.
I rely on her as much as she relies on me, I think. Truth. I think if most guys were honest, they would have to admit to that too. She's my rock.
Many healthcare professionals want to reduce accidents, but transparency remains a major barrier.
It's long past time that we have a national conversation about these deaths in hospitals.
A requirement in the Affordable Care Act encourages Medicare providers to report medical errors, but it stops short of requiring all healthcare providers from participating.
The best hospitals find ways to create safety nets around the mistakes they expect people to make. So they double count the sponges. They use barcoding technology on their sponges, for example, to make sure that they're not accidentally leaving something in a patient after an operation. There's barcoding for medication administration now, too.
While technology might help, simple, inexpensive things like good hygiene can prevent infection. In Alicia Cole's case, the state health department found her hospital had broken several patient safety laws.
Ask your doctor, what is his infection rate for the procedure you're going to have?
Document everything. Take a little notebook with you, write everything down. Every drug they give you, make sure you've got your cell phone with you with the little camera, take pictures of things.
It's not right, and in a country as wealthy as the United States and with the resources that we have, there's no reason for patients to have to go through that.
Victims agree that individual patients must remain vigilant. As families fight for transparency and accountability, they hope their tragedy will help others avoid the trend of deadly mistakes. In Los Angeles, Ramon Galindo, RT.